right. Hello, everyone. Thank you so much for joining us today. Welcome to the Vivian A. and James L. Curtis Center for Health Equity Research and Training virtual seminar series. My name is Jacqueline Hawkins. I'm the director of the Curtis Center, associate professor of social work, and the pilot feasibility co-director of the Michigan Center for Diabetes Translational Research here at the University of Michigan. I am so pleased to welcome you to the Curtis Center Health Equity Seminar Series. Today's guest speaker is Dr. Derek Griffith from the Department of Health Management and Policy at Georgetown University School of Health. I'm going to introduce the speaker in just a moment, but first I want to begin by acknowledging the land we're on. The University of Michigan was formed and has grown through connections with the land stewarded by the Three Fires people, who are the Ojibwe, the Ottawa, and the Powhatan, along with their neighbors, the Seneca, Delaware, Shawnee, and Wyandot nations. Now, I want to share a few housekeeping items with everyone here. So first, we've activated the live transcription feature on this Zoom webinar, so please be sure to turn it on if you would like the closed captioning. Second, should any questions arise during the presentation, we ask that you place them in the Q&A box and we'll address them at the end of the presentation. We're also planning for a 40-minute presentation by Dr. Griffith, followed by about 10 minutes of Q&A. And for those of you who are here for continuing education credits, be sure to remain for the duration of this live session, and also make sure you respond to any poll questions that Dr. Griffith asks. If for some reason you're not able to use the poll function, please submit your responses in the chat instead. So now I'd like to introduce our speaker for today. Dr. Derek Griffith has been with us at the Curtis Center since 2021, where he joined as one of our external advisory board members. He is a professor of health management and policy in oncology at Georgetown University, where he founded and co-directs the Racial Justice Institute. He also founded and directs the Center for Men's Health Equity. Dr. Griffith has expertise in cancer disparities, translational genomics, qualitative research, behavioral interventions, community-based participatory research, health behavior, health equity, and implementation science, in addition to men's health, precision lifestyle medicine, and structural racism as a determinant of health. Dr. Griffith serves as the chair of the Global Action on Men's Health, a global men's health advocacy organization. He's also a contributor to and editor of 3 books and the author of 170 peer-reviewed manuscripts and book chapters. He's been principal investigator of research projects funded by the American Cancer Society, the Robert Wood Johnson Foundation, and several institutes within the National Institutes of Health. Recently, he received a citation from the president of the American Psychological Association for, and I quote, his extraordinary leadership in addressing the impacts of racism on the health and well-being of the nation, and specifically for African American and Latino men. We are so very fortunate to have Dr. Griffith with us, and he's now going to present a vision for Black men's health and well-being. Dr. Griffith, the floor is yours.
Thank you very kindly, Dr. Hawkins. And let me also say a warm welcome to, or hello to Dr. Watkins. She and I have been working together for more than 10 years. I won't, because that will make her seem older. So we won't go there. But thank you very much for this opportunity to share with you, I look forward to the discussion and chat at the end. But I want to talk about this idea of having a vision for Black men's health and well-being. Before I do that, let me also acknowledge my team here in the Center for Men's Health Equity. These are the folks who make all of our projects and all of projects run and make my life easier. So I want to make sure I acknowledge them for all the hard work and wonderful work that they do. So I think our first poll question is just to get a better sense of who's in the room. Actually, let me make sure I'm not even sharing my screen. Um, sorry, 1 second. So this was just the title slide. This is my wonderful team. And so our first poll question is just to get a feel for who's in the room. Um, so if you could take a second and just give us a sense of what field you're in, um, that will help. And let me also say a thank you to Kirsten, who's been helping me behind the scenes get everything organized together, get me organized and together um, for this presentation. Kirsten, you'll have to tell me how and when to move forward. Um, okay, thank you. So I'm going to start with talking about a vision for one primary reason is that often in public health, particularly in men's health, um, in the health fields, health sciences, we tend to focus more on the problems, on the barriers, on things like racism, various forms of racism, and other kinds of structural oppression, and less on what are we actually trying to achieve? Where are we actually trying to go with the work that we're trying to do? And what are the lives we're trying to create? What is the space we're trying to create? And so part of what I want to do is really think with you, how do we think about that? What do we think about it? What are some of the things and the components that we want to consider? But also, why is it important to think specifically about Black men's health and how do we actually do that? So there are two parts of this, me playing with this kind of idea of a vision. One is sort of the vision as you would think about it in this context of, what is the thing that we're trying to see and achieve and so forth. And so if we're going to create a state of health equity and well-being, then we need to think about what that's going to potentially look like. We also need to think about what does it mean to actually have such a vision? So I'm also playing with the idea that, going to the eye doctor and so forth, they check your vision. And so part of what I want to do is walking through the presentation is to provide context for the data for the question of thinking about Black men's health. And so checking your vision, correct your vision, and really explore and identify some of the assumptions, explanations, some of which are accurate, some of which are less so, about Black men's health in particular, and then clarifying your vision, making sure we understand what we're looking for, what we're looking at, and how we're going to approach these issues. To do that, I'm going to talk about through a couple things. Describe and define men's health equity and men's health, talk about Black men's health patterns, and outline a process for creating a vision as we sort of have just briefly described. So let me start with some of the data so in terms of checking your vision. So we have to always remember in the context of men's health, what makes men's health an interesting and unique scientific question is the fact that men are structurally advantaged in most areas of our society, if not all. And I know I've gotten in trouble before for saying that, but I'm not going to not say it. This is just a concrete example where we've seen men's earnings far outdistance that of women doing the same jobs, doing the same kinds of things. So this kind of gender pay equity does have an important foundation for how we understand the societal structures and the kind of things that come out of the structural inequalities that we see in society. What makes men's health an interesting issue and phenomena, it's one of the few structural patterns that we see where having that kind of structural advantage has not necessarily led to better health and better health outcomes. And it's particularly interesting as you look at this in historical context and through this historical period. So this is a graph of just over 120 years of data looking at life expectancy by race and sex. And so, when I would teach there at Michigan or when I've taught classes here and there and other places, one of the things I would have students do is sort of walk through and break down this, what are they seeing in this particular slide? Here you can see very much that everybody's living longer, folks are getting healthier, with the exception of in the last few years, that we're starting to see a decline in life expectancy across the US and particularly for Black men. We'll get into this more in just a minute. But what you also see is that while we've seen some progress in making racial disparities closing and decreasing, we also seen an increase in sex differences in life expectancy over this time period as well. What I want to point you to for this purpose, this particular slide, is how close the images are when you're looking at these things on the left of where they were in 1900. That you have when you look at sort of white females versus black females, I'm sorry, when you look at white males versus white females and then black males and black females, you see the gap relatively small. And you can see if you look, over to the right, that the gap grows over time. The question I have is why is that the case? And how is it that everybody's living better, living longer? The technology that we've had, why is that differentially affecting folks both by race and by gender? And so this is highlighting that while we treat men's premature mortality, men's shorter life expectancy as though it is something that is just commonplace, it's not something that really has existed before the 20th century. This idea of gender differences is something that we now treat as normal, but it really is a 20th century, 21st century phenomenon. And so when we start to break this down a bit more, we can see the differences in life expectancy. Again, we'll start with by race. And you see that we're actually making some progress. Now, the gap is still quite significant. So don't get me wrong that we don't need to continue, and I'm not going to continue with my own work, continuing to focus on racial disparities and racial inequities. But what I also want to point you to is that when we look at within racial group differences, that we also see this particular pattern of the difference among Black Americans between Black females and Black males has actually grown quite significantly over this 120-year period, 121-year period. And so what we see is that how do we explain that? And I could show you the same thing for white Americans. I could show you the same thing for all Americans. This pattern basically holds that the gaps were relatively small in 1900. The gaps have grown fairly consistently consistently over the years. And so why is it that we've seen these changes over time? And so the other part of this picture that we're struggling with is there's not a space to talk about men's poorer health. So within the context of National Institute on Minority Health and Health Disparities, definitions, particularly from the CDC and others, gender disparities or the differences, particularly in life expectancy, high rates of premature mortality, there's not a definition or term that allows us to focus on men's health in and of itself. So men have to enter this conversation about disparities, equity, inequities through race, through sexual orientation, identity, through other factors that may intersect with their sex and gender, but it's not something where you can look at the definition of a disparity, inequity, because men are structurally and economically particularly advantaged over in our society. And so the second poll question is, how do we think about this? And so what metrics should we be using to monitor success in Black men's health promotion? So I've mentioned life expectancy. I mentioned premature mortality. Clearly, one of the strengths of the Curtis Center and my colleagues there is both in terms of mental health, chronic disease like diabetes, as Dr. Hawkins was mentioned. So we have to think about, what are we using? And particularly, I want you to think about, should we be thinking about, what progress looks like, what success in men's health look like? Are we thinking about improvements in mental health? Are we thinking about things like infectious diseases like HIV? How should we actually think about these issues? And while it seems like, well, we should think about all of them, when you look at the ways that gender is brought into conversations, both domestically and we'll touch on globally, we have not seen most of the literature when you're talking about things like gender transformative interventions and so forth. The literature tends to be stronger in areas like HIV prevention, in some cases in mental health. And definitely, depending on how you think about domestic violence and intimate partner violence and so forth, where those things fit in the context of men's health is something that we have to really think about. Depending on who you talk to, some think of those as men's health issues, some may not. Um, yes, Deborah, we'll definitely try to see if Kirsten can share the results. Sorry, I'm not seeing them either, but I know she has them. So, um, but thank you for making that note. But the reason I'm sort of asking this question about, oh, thank you, perfect. Um, and I guess I cheated by telling you where I was going with life expectancy and so forth. But when you look at some of the larger initiatives, particularly globally, by the Lancet Commission, by WHO, and so forth, life expectancy and closing gaps in life expectancy or improving the health of men by looking at changes in life expectancy is usually not the metric of success that we look at. We tend to look at things like HIV or specific chronic diseases, but we're not actually looking at focusing on how do we promote health in these big picture gross measures like life expectancy, premature mortality, and so forth. Thank you for sharing this, Kristen. And so the reason that I'm asking the questions, the reason that we're talking about a vision is because we don't tend to have a unifying metric for what we're actually looking at. We also don't tend to have a lot of infrastructure as it relates to men's health. There are no national offices of men's health in any federal agency or organization within our national infrastructure in the Department of Health and Human Services and these other offices that are our federal offices. Um, the objectives in things like Healthy People 2030 don't map onto leading causes of death for men. They tend to focus on things that where men tend to be more vectors for women's health or just are issues that are basically just about the biology of male health around prostate cancer, for example. But it's not really thinking about, if we were really serious about life expectancy, you would want to actually focus on those metrics that are actually most important for determining how long did men live, how well did they live, and so forth. And that's not what we're measuring or including into things like Healthy People 2030. Why is that significant? It's significant because we tend to, for lack of a better way of saying it, teach to the test or promote health to the test, I guess is a better way of saying it here. And that public health departments, when they want to get things funded, they often use healthy people as the guide. If it's not included in healthy people, if it's not included in some kind of metric of that we've shown at a national level that we value, local, state, and public health, excuse me, local and state public health usually it's harder for them to justify why those kinds of things are a major focus. So it is significant that we have to sort of think about why these things are important and how both for men's health in general and specifically for Black men, these kinds of issues play out. So the third question, given that I was just showing um, the slide about there's not an office of men's health, um, there definitely are offices of women's health. There's now an office of, I don't remember the exact title, but sexual and gender minority health. Um, and so the infrastructure for other types of health has been growing, over time. That has not necessarily been the case with men's health. Um, and so the question is, if we're going to, again, promote health and use these kind of offices to monitor how we promote health, to explore what kinds of issues need to be done to disseminate effective strategies and interventions. What kinds of office and infrastructure do we need to actually have? So one of the things that has been somewhat, I don't want to say contentious, but definitely a conversation point when we sort of talk about men's health, gender and health, and so forth, is that we've had this conversation about a federal office of men's health. And it's good to see that, three quarters essentially of people seem to see this as an important, potential infrastructure or support. But this has been on the docket for Congress for at least 2 decades, and it has never been passed. And so despite it having bipartisan support, it has never, really seen the light of day. And so part of the question is, if we're all in agreement that this would be helpful and important, why is it not happening? And we're going to get to that in just a second. So this is just to show that these are not, while I'm focusing on Black men, this idea of men being absent in policy, or that when we think about gender in policy, that it's not necessarily unique to African American men. It's not necessarily unique to the US context. And as part of my work on global action, we commissioned this report that was written by Natalie Leon and Christopher Colvin about, how are men represented in global, in this case, cancer policy. We're actually releasing one on global mental health policy in early April, and then a couple others on men's use of primary care and men and sexual health later in this year, probably in June, Men's Health Month. So we're looking at it more categorically, but then also we'll look at the big picture. But the point is that in each of these contexts, when gender is brought up, gender is usually not considered a broad enough term that it includes men very explicitly. And when we do talk about men in those spaces, it's usually as a comparison to women, or it's not really looking at where men are doing worse. And so even when men are mentioned and they're doing worse, the explanations for why men are doing worse, or the efforts to address why men are doing worse in these big areas tend not to be as fully described, discussed, addressed as they do with women's health, despite men having higher rates of mortality for most of these, or worse health outcomes in these particular areas like cancer and others that are not necessarily just the sex-linked cancers like prostate cancer and so forth. So if we're going to better understand how to actually improve men's health, we have to think about, now that we have that context, what are the kinds of things that clearly that shows a rather fluid and complex sort of context. So what are the kinds of things that we would use to explain those differences that we've seen? And so how important is it? I think this is the last poll question. If we're thinking about Black men's health, most of the time we tend to think about these issues through the lens of it must be something that we fix about men. So we have to fix men's attitudes, beliefs, and issues as it relates to masculinity, that the problem with men's health is really in men's heads and in men's bodies. And one of the things I want to explore is how do you think about that? And how important is that versus potentially other things like structural factors as well? Okay. So this is, yeah, fairly consistent, that it's definitely part of the picture that we see, and we see it here. Three-quarters of folks feel like it's extremely important to deal with men's attitudes and beliefs about masculinity. What I'm also going to suggest is that it's maybe more of a both and, if I channel my community mentor for a long time, Mrs. Deloney. It's a both and more than an either or. Um, while this is important, what I'm also going to push today is thinking about, how do we think about men's health in a structural context? And if we use an intersectional lens, how do we, balance the fact that a lot of the structural conditions that influence Black men's health are really not necessarily unique to Black men. It's something about the racism. It's about the structural racism in context. And so, actually, I'm going to skip the poll question just to make sure I'm moving forward with time. So this idea, as I move into Black men's health, you see me sort of bounce in and out of it, and that's because the literatures have not necessarily always coalesced. And so I've built my career largely from this space in the margins and this idea of focusing on Black men's health and men's health equity by essentially pulling from the margins of health equity research and trying to build up the focus and attention to Black men's health and other groups that are marginalized in that space, or that we don't tend to prioritize, focus on, and think about. And same thing within men's health, that a lot of the work has homogenized men and treated us all that we're the same. and been thinking about, well, how do we look at men who don't necessarily fit all of these boxes, fit the same context, and where all these assumptions that we're making about men writ large apply universally to specific groups. As I mentioned before, I guess it's my Atlanta roots and my tendency, propensity for what I'll call good trouble. Depending on who you talk to, it's not always good. But I was quoted in a piece of the Washington Post looking at life expectancy in men's health about a year ago or so. And we talked about this idea that men are structurally advantaged, despite that men have shorter life expectancy, and they show data by race, among men, and then compared it to women's health and so forth. And the unifying thing was that it offended people, I think, both on the left and on the right. The fact that I was focusing on men's health, the fact that again, I didn't write the article. Tara Parker Pope, who's actually the editor, um, wrote the article, and she tells a story when I chatted with her, she interviewed me that she wanted one of her male journalists to actually write the article. He was afraid of the backlash that he was going to get, so he didn't actually want to do the article. And so she and another female colleague decided they were going to write the article, and so they bore the brunt of this. So there were literally about, and you can still go, this is the follow-up article that this quote is coming from. But the original article had about 1,000, I think it's 980 something comments, which for just a regular article on a just random weekday is unusual in the amount of attention that it got. It triggered her to then write this second piece where, because people were so offended by the idea that we were talking about men's life expectancy, men are advantaged in every area of our society. Why do we need to be focusing on men's health? And, the reason that men die prematurely is simply because men's attitudes and beliefs. And so we don't need to be focusing on men's health. All health is men's health and so forth. And so we had all of this response that we got and that she got, and she was really surprised, and particularly how offended people were and how strongly offended they felt by the idea that men are suffering and that men's health was actually worse and that we needed to act and that we were suggesting doing something about it. And because others say that longevity is in the longevity gap, the life expectancy gap is simply due to biology or men's sort of intrapsychological sort of factors, that we should just accept it. But the idea is, are there things that we can do more? And are there ways that we as scientists can really push things to go forward? Yes, toxic masculinity and how we consume these ideals, these negative things are definitely part of it. How we buy into notions around patriarchy and so forth are definitely important. But we want to sort of also look upstream like we do for other types of health inequities as well. This is my favorite. I got to find another image or another quote from AHRQ or somebody. So I'll look for others in the future. If you have them, please share them with me. Of just real ads that do this kind of work that really focus on have a particularly narrow view of how men, what are the determinants of men's health? Sorry. And so this particular ad, this is a real ad from some years ago now, where they were trying to promote preventive screening, men to get sort of well-manned visits for health and health promotion. And this idea that the reason, and so they were attacking men and men's ideals of um, why they didn't go to the doctor and just saying, well, it's just because men are stubborn. It's just because men don't want to go to the doctor. It's just because men, it was all about sort of, again, attitudes, beliefs, and so forth, as opposed to, are there things in the structure or the experience of going to the doctor? Are there things in their lives that are more important? Are there other contextual factors that we tend to focus on or focus on and consider that are actually important to factor into this picture of how we need to get men to actually think about their health and promote their health more effectively? Let me quickly go back to something I said. I know some, again, say, well, all health particularly when it comes to thinking about health research, that historically all health research has been, they say it's been like all health has been men's health historically, and then we've had to create a space for women's health. My friendly amendment to that, to my colleagues, is that I think all health has been male health. It has taken a very narrow view of men. It is, yes, used men's bodies and men's biology as the standard, but it has not used men and their totality as a whole man, including psychosocial factors, structural factors, other things that play into this. That is why men's health exists, and we're not just talking about male health. Those factors have not been seen and considered and brought into this picture and really shaped how we look at and promote men's health in general. So, yes, we do need to do better at actually broadening the landscape, the scope of how we think about health and make sure that women are not rendered invisible and other groups are not rendered invisible in that space. But the idea that we have actually had a field that really focuses on men's health for me is actually just not true. Because these ideas around structural factors, social factors, and other things that actually do just like in any other population, primarily are the things that affect your health, have not been the things that have been brought into men's health and Black men's health specifically. And so these are notions that have gotten picked up by Richard Reeves and others, um, where it's become clear that this idea that the problems of men and boys are not just in our heads, that they're structural in nature, and yet they're rarely treated as such. And so we tend to treat, and he's just being more pithy with what I was just describing, that the problem with men is often treated as the problem of men, which is what you saw in that quote from AHRQ or the ad from AHRQ that to fix it the idea is, oh, we just need to fix men, which meant that we didn't need to. It kind of absolves us as a scientific and a service public health community and medical community of actually having any role in fixing these issues, because it's just men that we need to fix. So if we, basically men go off and fix yourselves, but we as health professionals don't need to think about how our services gendered to actually consider men's health. How are men underdiagnosed for particular things like potentially mental health, depression, and other related sort of constructs or other subconstructs within the mental health arena? How do we actually think about these issues is something we tend not to decide and include in those particular issues. And so it's really saying that we need to look at these things in a broader way and correct the ways that we, again, correct the vision that we have for how we're seeing men. And so we see that in his book, he does a great job of documenting how men are falling behind. So this is sort of the counter to what I was saying about men being structurally advantaged in every area of society. Depending on how you think of structure in society, when you start to look within institutions and structures, in the educational system, it's not quite that straightforward and clear. Boys and men are falling behind in primary school and college. And so the educational system is not necessarily equally benefiting males and men. The labor market, and particularly when you look at things like unemployment, men tend to have higher rates of unemployment than women. And so those kinds of things, some of that is the economic shift and just technology and those kinds of things that we have sort of recognized over time. But it's important to recognize that those labor market shifts are not structurally advantaging men in the same way. And again, with the changes, the more progressive sort of way of looking at family roles, family responsibilities, and so forth, in Richard Reeves's words and work, has left men sort of dislocated or lost them sort of the identity that came with basically being a family provider, because we no longer have that sort of anchoring role and identity that is just expected from how we sort of see the world. Um, let me go back to, at this point, let me go back to the last poll. And so going back to that, yeah, so in the context of what I was just describing, to improve Black men's health, how important is it to change the attitudes and beliefs about masculinity, not just in men, but also in men's partners and families? So one of the things that the work of John Olaf and others, again, have said that men don't necessarily just define the work to understand how men sort of understand what it means to be a man is not just sort of within men and just as men sort of segment themselves off in society. It's reinforced by the women in their lives, by partners, by love interests, and just parents, loved ones, and so forth. And so it really is important to think about, how do we need to think about, or what is the role of women, partners, again, regardless of gender, um, and that we need to think about how do those contexts really need to influence the ways that we think about the notions of masculinity. So is that a space that we can enter into and have more of a conversation about? So thank you for that. And yeah, it seems like we're generally in agreement. Again, three-quarters of folks are saying this kind of thing would be important. And so to pick up where we were, part of this, again, is pulling on this idea of the man box from Promundo, which is now Equimundo, this idea of thinking about the values, the beliefs, the perspectives that are shared and communicated by parents, families, media, peers, and others that do reinforce the ways that men think about it, but also support these ideas and support the structure that we have. And so they're the vehicles through which we get these messages and that reinforce the messages that we're often focusing on when we deal with men's health and we deal with the psychosocial side of men's health, about sticking to gender, the rigid gender roles and those kinds of things that we see, that are harmful aspects of the ways that men interpret what it means to be a man or perform what it means to be a man. Those factors we have to sort of think about them more explicitly. And so this idea of where does health fit into this picture, is something that we have to consider. And one of the things we know from the work of Bird and Riker, who actually did the book Constrained Choice, which was again looking at, in a gender context, they weren't looking at both men and women, or just all societal factors, and thinking about how does health factor into the ways that people think about their health and well-being. And their point was, this is again a quote from their book, and I think it applies well and lands well with the work that has been led and pioneered by folks who've been at Michigan, whether it's Sherman James and the John Henryism hypothesis, some of the work that Woody Neighbors was doing, and others, that this idea of making health a high priority is really something that is not, it comes after you're thinking about other roles and responsibilities. And so it's really thinking about, and we value men for taking those kinds of priorities and those kind of rethinking how they approach health, that health is not the primary thing that they're looking to try to be successful in, that they're actually trying to take care of family roles, responsibilities. It's recognizing that health and even manhood are relational definitions, not things that are just about the individual, in and of, in this case, himself. And so these are just quotes from some of the qualitative work we've done over the years that talk about how initially, in the first one, it was a study, one of my first, on how men thought about the structural conditions or context for thinking about prostate cancer risk. And, it was just highlighting that men were much more focused on, how do I provide, how do I continue to support my family, my loved ones, my community? How do I do that? And what kinds of things? Those things were far more important than him taking care of his own physical health, mental health, taking breaks, taking rests, and so forth. Very much, again, consistent with the story of John Henry and the notion of John Henryism. And how do we define a man? It's really through, again, more of that relational sort of aspect of these things. Now, one of the things I also want to, before I continue, is make the point and reminder, yeah, these are not unique to men. These are things that I would say is really more about adulting, if that's even a term, than necessarily it is about men in and of ourselves. because this is something if you any women, any folks of indie sort of identity and experience and so forth, these are things you do as an adult that you put family, loved ones, responsibilities, and so forth first. These things just don't tend to make their way into the ways that we can think about and create a vision for what is important to do in the context of men and men's health. So that's why I'm raising it here, not to say that this is something that is unique to men in and of itself. One of the other last parts of this is thinking about what's the structural context for thinking about men and really naming that much more explicitly. This was from a paper that we did a few years ago, trying to basically understand how do we need to make sense of the fact that Black men at this time, in the first wave of the COVID pandemic in 2020, had the highest rates of mortality during the period, not just from COVID, but from other chronic disease and other factors that were exacerbated by the stress of the context, the position, um, the period, I'm sorry, that were happening at the time. And so you did have this idea of using both combining an intersectional framework and syndemics, which tries to look at things in context and looks at um, health conditions that don't necessarily I'll say logically sort of fit together. So why would COVID or some kind of infectious disease co-occur in the same population with somebody with a group that has a chronic disease? Well, it's usually about the structural conditions that are shaping those and that particular disease interaction, like a stress response, that is explaining that has implications for both. And so this was our effort to try to explain how these factors fit together, why they were sort of clustering, why you have this clustering of risk in particular groups like Black men. And so this effort to really apply intersectionality has been something to men's health and to particularly Black men's health has been something I've been trying to do for more than a decade and really thinking about it in very specific ways. And so as we start to clarify and create a more precise vision for these types of issues, that we have to think about the ways that an intersectionality lens or intersectional lens can help us to do that. One of the things that is here is that this paper by Kimberly Crenshaw um, was really helpful for me in really refining, not just sort of using intersectionality as a broad sort of term and concept, but it was really sort of thinking about how do you break these down into different, essentially, mechanisms of why structural factors affect men and men's health or affect a particular population of interest. And so the structural and the way that she characterized it, in my application, is that it's talking about the characterization of the population. The political is looking about, is the population of interest included in those kinds of things? So same way that in the way that I was describing the cancer report that we did with Global Action on Men's Health, that men are not necessarily often included in those things in a very explicit and visible way. And then the broader sort of way that men are, the images of men are created and reproduced in larger narratives that make their way into health spaces and other professional contexts that have implications for how we think about that. Those representations have meaning and purpose and shape these kind of things in a particular way. And so we have to really think concretely about how do we look at those mechanisms more specifically. And so as we get to closing and thinking about how do we clarify this vision and how to create this vision of the future, again, I have laid out the vision of the past and the problems with the way that we're looking at things now, but it really is thinking about, yes, I'm definitely 10 toes down with focusing on and thinking about, anti-Black gender racism as a way to think about what are the structural barriers to Black men's health. But it's not enough to just focus on those barriers. We have to think about what are the things that help men to find meaning, purpose, connection, support, love, the things that will define how they will define being healthy and well. How do we think about the assets and strengths and aspirations, values, goals? What are the kinds of things that men are trying to promote, leave as a legacy, see as important to them that are actually those things? And when I talk about a vision, that is more of what I'm looking for. One of the ways that one of my, I'll call him adopted mentors, Collins Ariambua, talks about this is when you're thinking about promoting the health of a particular population group, we haven't thought about this as it relates to men, but I think it applies well that he talks about you can't just look at a group that you're trying to improve their health as just being devoid of assets. You have to actually find something positive in them. And if you can't find anything positive and you can only focus on their problems, then you're likely to become part of their problems. And I think that has been the case with some of the ways that folks have approached men's health, and particularly Black men's health, is that we're looked at as basically a collection of problems, a collection of issues. And so it's important to think about the way that we approach Black men's health and the assumptions that we're making, and to not contribute to the problems of Black men's health by only looking at us as a collection of issues, structural conducts and other things that are only about the problems and the issues. What are the assets that you're seeing in Black men that we can actually build on and build from? And so as we shift to thinking about what are some of the things that we want to focus on, I want to sort of introduce the idea that we need to move into. We often look at the WHO definition of health from the 1940s and think about health and well-being being in that picture. But usually we don't, so we just focus on health and we only sort of pay lip service essentially to the well-being side of things. And what I'm suggesting is that we need to really look at health and well-being in a much more holistic fashion and bring those two pieces together. And when we think about things like mental health and so forth and self-care, which would be sort of the ways that individuals may approach their well-being in addition to their mental health, that we need to think about and figure out a way to normalize men taking better care of themselves as individuals. Um, we did this with a project called Rooted and Rising, the Rooted and Rising Collective, where we trained young Black men who were social media influencers. They had a collective following, as you see on the screen, of about 1.5 million followers. And so we trained them both in business, or had a person whose expertise was in business. And then I developed the mental well-being curriculum. And we looked at how to actually help them incorporate these things into the art that they were already creating and into their actual voices and so forth. And how could they incorporate these notions about mental well-being into their lives? And so it was short version successful. And so it was really important to do that in young Black men because of the mental health issues crisis that we're facing in young Black men. And so it was just showing that these things were successful, both in terms of how men talked about it for themselves, the young men talked about it for themselves, but also when they showed those videos and compared it to videos that the content that the young men, the social media influencers had created separately, that they were more likely the folks who viewed it, because they surveyed the viewers, when they watched the content that included mental well-being from the Rooted and Rising content, the participants said they were more likely to embrace and engage in self-care than when they watched the other videos and content that they had. Again, they were already quite successful. Without getting into the weeds of this is just from the book that I had the pleasure of working with Dr. Watkins and the fellow that actually came, that was working at Michigan, James Smith from Australia. And so, but it's in the context of that book that we were sort of mapping these things onto what are the kind of contributions and factors we need to think about as it relates to promoting mental health and well-being. So I've taken you through down this road and down this path of thinking about the ways that we have addressed these issues or thought about them, tried to make sure that I covered describing and defining mental health equity, the patterns and the causes of Black men's poor health, and a process for creating a vision, or at least considering what are the things we need to include that are different. And so we have to again start with the fact that these Black men, we as Black men, do have some strengths, some agency, some opportunities, and some resources to bring to the table. And that, we want them, part of what you'd want in a society that's really valuing well-being is to focus on things like we have from this Muhammad Ali quote, that I know where I'm going and I know the truth, that I don't have to be what you want me to be. I'm free to be what I want. And there's really no more pithy sort of way of thinking about what our ideals are supposed to be um, in terms of promoting well-being in a society. The idea of what we're trying to promote is to build ideas and concepts that, again, are about what is the legacy that you're leaving. And so, a vision for Black men and Black men's health really, of course, played off of the title of this is the second edition of Naeem Akbar's book, New Visions for Black, or Visions for Black Men, and then the second one was New Visions for Black Men. But it's thinking about how do you create this space and this opportunity that men can think about what their legacy, their opportunities, what are the kinds of things that, again, utilize a relational definition of what it means to be a man and how those things can be applied in a larger context, in a historical context, to think about what is the next generation that you can leave for those in society. And so, again, it's about creating this vision, but to create a vision or to take steps toward a vision, we have to have first the ability to envision. So, thank you.
And thank you so much, Dr. Griffith. That was a really wonderful and thoughtful presentation. I want to take a moment. So we just have a few minutes to field some questions. If folks have questions, please do enter them and we can start with the Q&A. So I actually will start with the first question. You talked a little bit about the National Institutes of Health and other entities that fund men's health research. And I'm wondering if the present day conversations, if you've seen any opportunities for that increased focus in men's health. You had mentioned the creation of an NIH Institute, but also through different funding mechanisms and funding announcements.
Yeah, thank you for raising that. I mean, I think there is, we're in a moment where there's being more attention to men's health in general and Black men's health. You have the Congressional Social Commission on the Social Status of Black Men and Boys. Um, you have some of the work that Al Young there has done with the National Academies to really highlight in the context of health equity, what are the unique sort of contextual factors and features that are shaping Black men's experiences and identities and so forth. And so, but the other one is that the Office of Research on Women's Health, I think is they need to be credited for um, thinking about gender in a broader way than they typically have, and probably, frankly, have the responsibility to. Um, their work, they did a conference, I think it was October 22, on gender structural discrimination and structural racism in health. There's some probably better title to it than I'm not remembering, and it had other commas and ands in there and other things in there. But it was really an effort to try to bring together folks who were looking at gender and health very broadly. Some clearly focusing in anchoring it in women's health, but also looking at um, LGBTQIA populations, looking at also men's health in that larger picture. And so it was really thinking about, how do we need to work together to come up with a vision or a way to support research on gender and health that is more inclusive. And so I think they're probably the best example, the most shining sort of hope for how to think about that. Um, there's also Atlantic Commission on Gender and Global Health that is they have a report that they're about to publish. I'm not sure when, but the commission has been working for a few years. I understand they have a full draft of that. And so there are going to be things that are moving these kind of issues forward.
Thank you. And I want to say you've got so many, thank you for this wonderful presentation in the chat. We've got three questions in the last few minutes. Maybe we could answer a couple of them.
Sure.
Uh, what are some other examples of innovative programs or initiatives that you might want to highlight that benefit men's health?
Well, I'm biased, and it's not just because I'm here and so forth. But Why Be Men has got to be one that's high on the list. I just didn't want to make it seem like I'm trying to kiss up to my friends over there. But that has to be something that we look at as another shining example, and the work and the effort that has gone into working with men to really um, help men to define for themselves what are these kinds of things. Particularly, again, we've seen this focus on young men in that space. I think that's another one I think that is a just a concrete example, a great concrete example.
Absolutely. And sort of in that same at the with that same point, CJ Goulding actually put in the chat, thank you for this presentation. With Boys in the Wood, we use nature as a tool to help Black men restore and reignite their best selves. It aligns so
Mhm.
strongly with this research, and she'd love for a chance to connect and collaborate.
Absolutely. Look forward to it.
Yep. So you can absolutely follow up with Dr. Griffith. Okay, so Shayla Harrison gets the last um, question here. How can we get younger Black men involved in their health besides on social media? Many ignore those videos or ridicule them because of toxic masculinity.
I think we have to do, I think what YB Man has been a leader in doing is, okay, let's go talk to them and figure out how do we need to get them involved? What are the things that are important to them? I mean, clearly with your community-based work, in the different cities in Detroit, in different cities in the Southeast Michigan area. Like, I think we've got to sort of figure out. I don't want to presume like I have nephews that are this age, but I'm not going to presume like, that I understand fully what they need and what they need to do. But I think this is the essence of community-based participatory research, where you bring together the expertise. We as a scientific community may have certain expertise, but clearly they know their lived experience, their context, and so forth. And I would also say for that younger men group, we would want to engage, do what is characterizing qualitative research as shadow data, but talk to folks who are in their environments about how do they see young Black men. So shadow data is doing often it's in the again qualitative research where you're talking to people who are in the space or in the context relationship with folks who are the again the population of interest. They're not members of that group, but they have a good knowledge of and experience of and potentially some influence over. And so, whether it's parents, whether it's loved ones, siblings, aunts, uncles, folks in the community that have a unique perspective that may complement, not replace, but complement the ways that young Black men are seeing the world and the kinds of things we might actually do. But getting information from them, and as we just talked about, both in the poll and in the presentation, making sure that we actually figure out how do we engage and reinforce the positive messages that we're talking about as a way to that we have to engage not just the men themselves, but also their community around them is the point.
Absolutely. Thank you so much, CJ Goulding, for those really great questions. And thank you, Dr.
Yes.
Griffith, for sharing your research and your findings with us today. This has been super thought-provoking and inspiring, especially for me to do some of this work. I do want to thank our attendees also. And just a side note, you'll find recordings today of today's seminar, rather, and other presentations on our Curtis Center website. Thank you again, Dr. Griffith. Everybody, have a wonderful rest of the week.
Okay.